The nice thing about iSALUS is it includes optical, behavioral health, the clinical aspect, and you tie them in all together. So we have the system in place that allows that, but what's more important is we have the staff that actually utilizes that system in an integrated fashion.
So unfortunately, the problem with using the two systems, having an EMR separate from the processing, was that there's a lot of double data entry. We did have to do a lot of manual adjudication of the claims. For example, we take Medicare-like rates on hospital claims. So all of that calculations were done by hand. All our claims were manually filed and stored. We didn't have a place to keep them electronically. So, that was a big issue, things getting lost. We didn't have a very streamlined process. Claims were being processed months out, I should say. So that was a huge issue for me with RPMS, was just how time-consuming and how much manual labor went into it.
We actually had some vendors wanting to not serve our patients anymore because it was getting past that 30-day deadline, but we got it back down to the 30-day deadline with no problem after iSALUS.
In terms of some of the different government programs like meaningful use and those types of things, I found the provider dashboard to be very helpful. It was nice, I could log in every day, kind of check and see where I stood with things, and it made it easy for me to sort of know what areas I needed to focus in on with the electronic record and make sure I was doing all my appropriate documentation. And again, the support was there from iSALUS to make those changes when we needed to do something a different way, or again, to find something maybe that would fit into the way things flow in our clinic.
I'll tell you something, what I say when I'm interviewing counselors to come into my facility and to provide services, the very first thing that I say is, I'm looking for a therapist, I'm not looking for a paper pusher. And iSALUS is able to provide that to me.
User population is the funding source from IHS that we have. So with that being said, everybody's afraid to leave RPMS because they're afraid they can't get the user pop numbers. The one thing that we had with iSALUS is we worked with them and with IHS on just migrating that data over. And now there's a seamless process of putting that. We do it monthly now, which is nice. So again, we're doing everything that RPMS does as far as getting data over the user population count. I think that's very important. One of the ways iSALUS has really helped us as a partner and collaborating together is anytime we need something, they're always there. We call, they're phone call or email away. That's very important, the customer service aspect. Any of my staff ever reach out, they get response as needed. And if it's an emergency, they're on it right then. I think that's very important for any IT system to have that kind of support on the back end.